This is ICAST News, live and direct from United Nations headquarters in New York City. This is a healthier world. I'm Dr. Ben Milgram, and this is Dr. Sandershan Narula, former medical director for the UN. Dr. Narula, wonderful to see you again. Last week we talked about Zika virus, and would like to continue that discussion this week. So, what's news in the Zika topic?
I am not an expert on the subject. Okay, let me make it very clear. I get all my wisdom from going to websites of World Health Organization, CDC website, HR portal, UN HR portal, which is a very good source of information, New York City Department of Health and New York State Department of Health. I go to all those websites to get all the information. Having worked with UN in the past, I was used to getting the information from all those sources to be able to apply that information to wherever it was necessary. And I must say, in these few days, a lot has happened. Or maybe I've read a lot, so a lot has happened. One thing which really surprised me was, we talked about the mosquito, Aedes aegypti, and that mosquito is there in certain parts of US. So I started looking at those places. So I know it. Remember we talked about it, it's there in Florida and it's also there in Texas. So I started going to the news from Florida, and I was so surprised to find out that in that state, they have started testing mosquitoes for Zika virus. That was something really very new for me. They are putting traps in different places to collect mosquitoes, and then they test them for Zika. And when I was looking at that, then I realized there are so many cases in the US, though there's no local transmission so far, and we hope it stays that way. But there are over 500 cases, imported cases, the cases where the infection happened during travel in this country.
Right.
And there are about over 150 pregnant women positive with Zika virus. And so this was, what I will say is that because of our little conversation last week, it really increased my interest in the subject.
Yeah.
And I've really read a lot. And in that context, you can ask me the questions now. I told you about Florida. Any other questions you want to ask?
So we have Zika in the U.S. There's been now hundreds of cases, as you said.
Yes.
And we talked last week about how this is a virus that's transmitted by mosquitoes.
Yes.
And it can also be transmitted sexually.
Yes.
Now, the cases that we've had in the U.S. seem like they've all been transmitted via mosquitoes in places that the virus is endemic.
Yes.
So none of these
Where
cases...
the transmission is going on. Yes.
Right.
Yes.
So we're not saying yet that mosquitoes are transmitting the disease in the U.S., but what we are saying is that there are people in the U.S. who have traveled to countries in Latin America where the epidemic is happening, and they've come back into the U.S.
Yes.
and have manifested their disease.
Yes.
And many of these cases are here in New York City.
Yes, there are. There was a little article about New York City this morning in New York Times, which I read regularly, and that article talked about that what can happen in New York City, and there I read that we have about 120 cases in this city, just in city, and outside city there are 50 cases in New York State. So this doctor has been, I think, where he practices, there are many people who are from Dominican Republic. So they keep going home, and when they come back, or before they go and they talk to him, he always tries to advise them how to protect yourself. And what's going on in New York City at this time is that, as we talked about it last time, that particular mosquito does not exist in New York. There is an Aedes virus, but it's not Aedes aegypti. It's not the one which generally transmits Zika.
So the mosquito that we know transmits Zika is not here, but its very close relative is here.
Yes, yes. And that close relative, the concern is that close relative might start transmitting. So there's a lot of emphasis in New York now in getting rid of mosquitoes. And I hear it every day on Channel 1 that we have to get rid of mosquitoes because the season is changing and more mosquitoes will be coming. So either we protect ourselves, we protect ourselves and we also get rid of mosquitoes. And also, why the emphasis is there, because the mosquitoes also cause West Nile virus disease. So that's why this emphasis is going on. And I was surprised. I went to pick up my grandson from his school on Friday, and there was a letter for parents, which every child was getting, telling them about Zika. It was for parents to know there is Zika virus, but there's no chance of getting it so far in the city. But again, emphasis was how to protect yourself from mosquito bites, and also to make sure the mosquitoes are not breeding around the place where you live. So to me, it looked very interesting when I saw that little paper being brought with my 7 years old grandson.
It hit home, huh?
Yes, it did.
And so it's all about mosquito control. I had a very similar experience on the subway since I saw you last, where I saw the first public advertisement warning people about Zika virus and mosquitoes. And so clearly this is something that is affecting us here locally. And this is such an international city where people are traveling from these countries every day. And again, the majority of people who have been infected with this virus don't even know that they even have it. We said that probably only about 20% of people manifest anything.
Yes.
So one could see that there's plenty of people coming back here that don't even know, aren't seeking care, but certainly people could have Zika. So it seems like at this point, this is mostly nervousness that this could spread, though we're not even sure if it even could. We're not sure if the mosquito population here is able to transmit. And we, again, have not seen any locally caught cases, locally transmitted cases via mosquito, but it seems like people are certainly on edge. Is that what your understanding is too?
Yes, especially when I saw this letter from school.
Yeah.
Yes, people are on edge in the sense they want people to be informed, because there is so much in media. So these letters coming from New York City Department of Health and Mental Hygiene, so they're getting from the right source, and that perhaps to calm them down or tell them your job is to protect yourself from mosquito bites, or to make sure the mosquitoes are not breeding around your house. But maybe they're also trying to tell them also to go to the websites if they want to have a little more information about it. So when I was looking at the Florida figures, when I was looking at the US figures, where they have these cases all associated with travel, then I suddenly thought there must be a systematic way of testing them, otherwise how will they know there are 120 cases here and there are 5 cases somewhere else? And then I started investigating that, and I realized there is a systematic way of testing. And New York City Department of Health has put that on their website. That what are the indications? They're not going to test the blood of everybody, whoever has been traveling and coming back, but they have come up with some criteria that these are the 4 situations under which that person's blood should be taken for testing. And they want you to call City Department of Health so that they can let you know that you have to request a form from them, and also you have to get their approval for the test. And they explain you everything, what type of tests you should be ordering, what all information is required to fill that form, how the sample should be transported, and who will get the results back. So because this is a notifiable disease at this time, so they really want to know where the cases are and what's going on. So there's quite a control, and the testing is only being done in city or state health departments, because this particular lab is under Department of Health, New York City. It's there. So maybe that's the only place where they're testing at this time. So I'm pretty sure, Ben, if you get a person with fever who has come with symptoms, who has come from those countries, it will be good for you to know. I know you already know it, that that's the place to call.
Well, I have to say that As a practicing doctor, reading the paperwork that has to be submitted to go through this made me shudder a little bit.
Yes.
But that said, obviously this is a very important thing that we need to think about when patients who are returning from areas like that, or in prenatal care.
Absolutely.
It's a very
most
important thing to consider
is that,
at this
yes,
time. So,
yes.
the New York State and city guidelines and the CDC guidelines have mentioned the groups of people that should go to their doctors and perhaps request testing.
Yes.
And those types of people or the groups of people that they suggested were?
There are 4 groups. One is the pregnant women who have come, who have been on those countries and they have come, returned here. Secondly, if the pregnant woman had a sex with the partner has been there, so this comes under pregnant woman. And also recently, CDC has also modified how they are going to count how many pregnant women with Zika are in this country. In the past, they were looking at symptoms plus testing results, and now they are just going by test results. That means they may be testing all pregnant women coming back from those countries, whether they have symptoms or not. So that's why the number of pregnant women with Zika has suddenly gone up. It's just because they have changed the criteria.
Because if you test more, you find more, so your numbers will increase.
Definitely, that's what's happened. And second is, of course, if somebody has come with symptoms and has a travel history, that should be tested. And then also, if a baby is born with those congenital malformations which are being associated with Zika, that baby's blood needs to be tested. And also, if somebody has traveled and come back and has developed Guillain-Barré disease, that's the 4th group that needs to be tested.
So if you have Guillain-Barré syndrome,
yes,
you're probably not going and thinking that you have Zika virus, but hopefully your astute doctors will think of that.
Yes, if you have traveled, of course.
Exactly.
Not otherwise, if you have traveled to those countries.
It reminds me of those commercials. I saw one that says it was for a pharmaceutical ad that ends, "Tell your doctor if you've had Guillain-Barré syndrome."
Yeah.
I would hope that's something that a doctor would know.
Yes.
About their patients.
Yes. Oh God! Once you have a patient with Guillain-Barré, you never forget.
Yeah.
You never forget the patient, and you never forget the disease.
Not a subtle finding.
No.
Yeah. So those are the people that should be tested. We said last week again that there's not a treatment for this. So the major thing we are concerned about is these birth defects. So. Why should men be tested then? Why is it important that men find out if it's not going to be a serious disease in them, and it's not something that can be treated regardless?
Yeah, because men will be transmitting. If a man has been infected, they could be transmitting Zika to their partners for 4 weeks, and if they have symptoms, they say to practice safe sex up to 6 months. I am a little surprised, but that's what I.
Right, just an abundance of caution that if a man has had it,
abundance of caution because of the outcome can be very serious. I think. Yes, and also WHO this morning has also revised its guidelines for women. Women who have been infected, they used to say they should not conceive for 4 weeks, and now they are saying they should not conceive for 8 weeks. So a lot of caution is being exercised in this area because still they are finding out. Maybe sexually transmitted are a little more than what they anticipated. And also one thing I wanted to say here is that when they said Zika virus is a public health emergency of international concern or whatever the word they used, it's just like Ebola. But the difference here is it's of international interest is because of the link between Zika and congenital malformations. That's what made it public health emergency, is that link, that connection.
Right.
Not so. Otherwise, there's nothing compared with Ebola, but that was important. That became an emergency. That's why everybody started looking at it. Is this possible? This link. And that's why WHO said what they said.
Right. So the other major thing that's happened since we spoke last is this group of. It's sort of unclear how this group came together, but it's this group of sort of experts in this field, self-declared it seems, And they have sent this letter to the WHO.
Yes.
Listing their concerns about the fact that the Olympics are going to be in Brazil this summer. So, obviously the Olympics is a major event, draws people from all over the world, and it's being held in Rio de Janeiro, which is one of the hotbeds of virus in Brazil. And we're bringing people in from all over the world who will then be returning back to their home countries. So one could see how that would not be ideal, and this timing clearly it was not at all not good at all. Let's say. So the WHO has said that they're not so worried, and they have not pushed to have the Olympics postponed. What are your thoughts on that?
First when I read the letter, I did see the letter. Of course, I think it was everywhere, the letter. And the concern seemed quite genuine when you read it. Because of the risk of so many people going back home and then carrying this particular virus. I think it seems that Zika infection itself has changed. In the previous, wherever the little outbreaks or wherever it was endemics, I don't remember seeing so many cases of microencephaly or any other congenital malformations. So maybe something has changed, and maybe these experts didn't want that particular virus to be taken back home by all these people who have come there for Olympics. I think that was the point they were making.
Yeah.
But World Health Organization said there's no need, there's no basis. There's no public health basis to do that, because people are traveling all the time. There has been no travel bans to any of those countries. People are traveling all the time. They are taking this virus, and WHO is working very closely with Brazil, with their Ministry of Health, and the priority is to get rid of mosquitoes. Though the number of cases are still not coming down, but they are trying their best, and they don't think this is going to make much difference so far as the spread of virus in different parts of the world is concerned.
Right. Still, their concerns are well noted, and if one could avoid Brazil, it would still probably be wise. Can we say that?
Yeah, especially if you're a vulnerable group, as we said last time. If you're pregnant, don't go at all. This is my suggestion. They can always talk to their own doctors about what they say. And secondly, if you're going, really protect yourself both ways, from mosquitoes and also from sexual transmission.
So if you're going to the Olympics, bring bug spray. Avoid stagnant water. I don't know what's going to happen at the rowing events, things like that.
But I have seen, when I was reading about some of the participants in these sports, that some have already said that they are not going, and others are saying they are going to go to their doctors, take specific instructions how to protect themselves, but they will go. So that's what I am seeing. There's so much information available now. So much is in the news. If we ever meet again, or whenever we meet again, I'm sure there'll be more. And I think both of us should tell the producer of this show that whenever we meet next, there should be one expert who should answer our questions. We are doctors, we treat people, and we will treat them if we happen to see them, though there's not much treatment except for advice. But I think we should have somebody who's really expert. And expert could be from CDC, he could be from World Health Organization, but they are the people who really know. Us, we are clinicians, and we will treat, or our job will be to diagnose and treat and advise them how to protect yourselves. And I know a little more about this protection, etc., because having worked with the UN and UN staff, traveled everywhere, I don't have that responsibility, but I'm used to that, advising people. So I think that, but we need an expert to answer some of our questions, and whenever we meet next, we should bring a list of our questions, but to ask that expert.
Yes, indeed, and the topic will certainly have evolved since then. So
absolutely. So much has happened in this week.
Yeah.
Yes. Yes.
Well, it is a pleasure to see you again, a pleasure to speak about this interesting topic, and we will stay tuned to see how this all develops.
It's always a pleasure meeting you.
Yes, indeed. All right. So for ICAST News, this has been a healthier world.
Thank you.
Thank you.